Why are we talking about digital? Why do we have to go digital? Okay. Well, what gain, what benefit, to what end are we, thinking about going digital? How would this help us? So we say some of the advantages of going digital in our denture production includes that we can achieve a reduced chair visit. Okay, so the amount of time you have to spend working on the denture is significantly reduced when you go digital. There can be improved accuracy and reproducibility. Okay, you can reproduce your denture with high precision and accuracy. The patient comfort is better when we go digital, and then we can be able to actually achieve digital record keeping. Imagine storing, you make a denture. How do you guys store denture now? Like, so if you make a denture for a patient, what do you do? Once the patient is gone, what do you do with the material that you used to make the denture, like the base, the impression, and all of that? What happens to them? You discard them, or do you store them and label them with the patient? Then have you got a file or folder, or what do you do with those information? In your manual denture production today, what would you do with the patient's impression, the stone cast, and all of those things? After you've made the actual denture that the patient will take home, what happens to the other materials that you produced in the process? Do you understand what I'm asking? Okay, what happens to them? Okay, you see, now when you go digital, you don't need to discard those things. You can actually store them. Right? You can actually store them and then reuse them if you need to reuse them in the future. So that is another advantage of going digital in your practice. So what we are going to do now is to again look at the digital tools that you need in your digital denture workflow, production workflow. Okay, so there are tools that you need during the during the time you are gathering the information that you need for the patient during the acquisition stage. There are tools that you need for the design, and there are tools that you need for the manufacturing. Okay, so what are the tools you need during the acquisition stage? You have the intraoral scanners, you have the CBCT, you have the lab scanners, you have the digital radiographs, and all of those things. So these are some of the tools that you need for the acquisition of the patient data. For the design, you need the CAD softwares and the the computer aided design softwares and the computer aided design systems. You need the 3Shapes for your thing. You need the EcoCAD, dental wings, and all of those systems that you need for the design. Okay, and then in the manufacturing, you need the milling machines, the 3D printing machines, and all the machines and all the other products that you need for the production of the denture. So you can segment the tools that you need for your digital denture production into three parts. Okay, the ones that you need for the acquisition, the ones that you need for the design, and the ones that you need for the manufacturing. Okay, you need to understand which one that fits where for you to be able to actually produce a digital denture. So what we are going to do is to go through them one after the other. Let's look at the intraoral scanning and the intraoral and the extraoral scanning systems. Now, let me see if Zoom has this function. Okay. Let me see if Zoom has a function that can allow me to. I'm going to stop this presentation, try to restart it again, choose an entire screen, choose that screen, to share audio, share a tab instead. Can you see my screen? Okay. Okay, I'm coming to that. That's not open. Chrome tab. Can you see my screen now? Can you hear the audio? Can anyone hear the audio? Okay. Okay, so what I want to show you is the first step in the process of digital denture production. And what we want to do is to look at the very first step, which is the intraoral scanning. Okay, this replaces your manual impression taken in your current practice. Okay, so let's look at this. Okay, was that helpful? Good. So, um, this is the first step in the process of digital denture production. Okay, the first stage is the intraoral scanning stage. I'm going to have to stop sharing the screen so that I can return back to my presentation. Where's my presentation? Okay, so we are looking at the process of intraoral scanning in digital denture production, and you can see the advantages that are listed there. It is seamless, it is comfortable, it is pain-free, and there is high level of high level of accuracy and precision. However, we got to know that there are times that intraoral scanning will not be appropriate for a patient. So there are still times when you might need to recall a patient for traditional impression taking. But due to the advantages that is associated with intraoral scanning, it is usually the very first choice in a digital workflow. So let's look at the advantages and disadvantages of intraoral scanning in a dental loss patient. In the denture production, let's consider a dental loss patient. Now, intraoral scanning offers several advantages for a dental loss patient, which includes improved accuracy. Okay, so with digital scanning, you can capture more precise digital impression, leading to better denture fabrication for a patient that is completely edentulous. There is high level of comfort for the patient. The non-invasive scanning process allows patients to relax, reducing the discomfort compared to traditional impression materials. Okay, and then we can say that enhanced communication can be achieved when you use intraoral scanning. You saw from the video that they were able to communicate with the patient, moving the teeth in different directions so that the patient can actually see what the treatment planning is going to look like. So the digital 3D image that is produced will enable the dentist or the technician to share information with their patient, which will improve the understanding and trust in the treatment process. You know, when you do the traditional denture production, you don't really bring in your patient after casting the impression to start showing the patient, okay, this is the impression that I've casted, this is that. They will not understand the impression that what you are showing them. Okay, you do the stone casting. You don't bring your stone cast to the patient and start discussing that with the patient, because what would they understand? What would they know? Okay, but in a digital workflow, you are able to actually show the patient in real time what their teeth looks like and what you plan to achieve. You saw from the video that they were even able to capture the bite marks of the patient to see where the patient is biting more severely and where the patient is biting less severely. So again, as well as the advantages of intraoral scanning, there are also disadvantages for an edentulous patient. Some of those challenges will include the learning curve. Again, remember we've talked about advantages and disadvantages of all of these technologies that we use in digital dentistry. Now we are looking at this with specific example of an edentulous patient, and we are specifying that again there is going to be a learning curve. The process can be more complex and require more skills compared to the traditional method of dental production. So once you already know how to do the traditional one, you still need to go and learn how to do the digital denture production and the digital scanning as well. So the fact that you know how to take impression manually doesn't mean that automatically you can handle digital scanners and begin to do intraoral scanning. There is still a time and a learning that is involved in it. So you still have to do that learning. There is mobile soft tissues issues as well. So scanning mobile soft tissues can lead to stretching errors and inaccurate scanning. So there are times when you can scan if the teeth, the soft tissues are mobile, very unstable. It may lead to some inaccuracy in the capturing of the oral structures. Okay, there'll be some level of inaccuracy in the capturing of the oral structures once that mobility is there. So you need to be scanning the teeth when it is in its most rigid form, so that you can actually be able to precisely capture it in a position where it is. Then there is also saliva management, which managing saliva can be challenging, especially in low arc scanning, leading to poor scan quality. If you have patients that have excessive salivary flow in the mouth and you're trying to capture the pictures of the different aspects of the lower arch, because if it was the upper arch, remember the saliva does not flow upwards. Okay, because the saliva is not able to flow upwards, it is easier to manage. But when you are doing the lower arch, then it forms as a reservoir for excess flowing saliva, and then that can also distort the image that you are trying to capture. So you need to also think about the saliva management in the use of digital imaging digital intraoral scanning devices. So despite these challenges, the long-term benefits of digitizing removable denture cases, they greatly outweigh the difficulty, and making intraoral scanners a crucial step in progressive and denture practices. So what we are saying is, while we acknowledge that there are some challenges we need to be aware of when we are doing our intraoral scanning, it is important for us to also know that the benefits of achieving a digitally produced denture outweighs the challenges that is associated with this first step in the capturing of the images. Okay, in the 3D in the intraoral scanning of the dental arch of the patient, we can overcome those challenges because we know that the benefits that we will get in the end will outweigh whatever challenge we have trying to capture those. So these are things that makes it necessary for you to upskill yourself in the use of these equipment. So the other one is the role of the CBCT for implant supported dentures. Again, we have talked about CBCT separately. We have talked about implant dentures. So how do we then understand the role of CBCT in implant supported denture? Now, when you are trying to acquire the information, CBCT can play a crucial role in the planning and execution of implant-supported dentures by providing detailed 3D imaging that enhances both the diagnosis and the treatment planning of any dental patient. Okay, it is an essential tool for dental professionals, offering insight that improves the accuracy of implant placement. and reduces the risk of complications. Remember when we talked about CBCT as a technology in digital dentistry, we said that it helps us to precisely identify where to place the implant, because we can be able to use the CBCT to map the bone density, to look at the nerves and understand their position, and look and be able to identify where it's best to place the implant. So in the use of in the production of implant supported denture, CBCT is very important in helping us to capture that 3D image of the jaw of the patient, so that we can precisely identify where it will be the best to place the implants that will support the denture. Okay, so CBCT scans are valuable for pre-operative planning, allowing for clinicians to assess the bone volume, the density, and the position of the critical structures like the nerves, the sinuses, and blood vessels around the gum area. You don't want to traumatize any of these vessels, so we use CBCT to actually precisely map out the locations of these nerves and these blood vessels, so that we can be able to avoid any damage to them while placing the implant. And also, we already know where the bone, how the bone density is structured in the patient mouth, and we can know the accurate place to place the implant and get the best effect from it. So the role of the CBCT for implant supported denture increases again and extends to its detailed visualization, which minimizes the association with implant placement such as nerve damage and sinus perforation. Okay, the associated complications with implant placement. So it minimizes the risk of associated complications with implant placement, which includes the nerve damages or the sinus perforation. Now, if you are preparing for exams, we're not talking about, I don't like to talk about exams, we'll talk about exams tomorrow. If you're preparing for exams, try to understand and remember some of these details. Okay? If you are asked in exam, what are the possible complications that can happen with implant placement? So we can talk about the nerve damage, the sinus perforations, and all of that. And CBCT is the technology that can actually help us to avoid some of these complications, because we can identify these vessels and be able to avoid perforating them in the process. So by assessing the bone quality and quantity, practitioners can actually determine the ideal implant size, okay, the type of the implant, and the placement angles, which will ensure optimal stabilization and osseointegration. So we need CBCT to be able to map out the size of the implant, the direction, the angle of the implant, and everything will be precisely placed in such a way that it will seamlessly integrate into the bone that is supporting it. So the CBCT also consists in the creation of custom surgical guides. So you can use it to create custom surgical guides, which are designed based on the 3D model created from the CBCT scan. So you can use the CBCT scan to customize surgical guides for a patient, which will ensure that the implants are placed with precise accuracy. So once we have understood the structure of the teeth and the location of all the nerves and sinuses and all the blood vessels, we can now still produce a surgical guide that will help us to precisely position this surgical instrument in the very place where the implant need to be. That will minimize clinician's error or any human error in the placement of the implant, because we have already determined the size of the implant using the CBCT. We've determined the angle of the implant positioning and all of that. So once that surgical guide is produced, then we can be able to put it in and precisely put the implant in the place where it is possible, where it will give us the best possible outcome. So this process not only streamlines the surgery, but also enhances the predictability of the outcome. Remember, our goal is to be able to do an accurate implant supported denture. Okay, so as dental technologists, it is not enough for us to know how to make the denture. It's important that we understand what the other processes that is involved in the production of the implant supported dentures. Then we talk about the card design for dentures. Again, this will give you some visual articulation. Tooth libraries and occlusal schemes can also be associated with the CAD design systems. The CAM manufacturing system, we have the milling system and the 3D printing system. So again, we have faster, economic, and improved materials in the 3D system. So it minimizes, when it comes to 3D printing, you are minimizing the wastage of materials, because the machine is going to use only the precise quantity of materials. Okay, remember, if you compare this to when you are manufacturing the denture manually, sometimes you put so much materials and then you begin to scoop out the excess of the material, trying to, sometimes it can get a bit messy in the area where you are producing the denture, especially if you are not very advanced in denture production, or if you are new to the system, you haven't learned a lot of the skills, you might struggle with material wastage. If you are the head of a dental laboratory and you have to deal with interns, okay, I don't know, do we have any person here that where you work as a technician that you deal with dental interns? Do you deal with technology interns? Does anyone here deal with technology interns in your practice? Nobody, okay. Well, Imo, you deal with technology interns? Okay. So when you deal with technology interns, one of the things you might struggle or be talking so much about is the wastage of materials. Do you observe that the way they manage materials is very different from the way you would manage your materials when you are working? Is that the case? Exactly. Now, even when after that 2 to 3 months, 6 months, they're beginning to manage materials again, there is still some level of, you have to try to put enough so that you can remove the excess and all of that. Once you go into the CAM manufacturing system, you are 3D printing, there is no material wastage. Okay, because the machine takes the precise quantity of material that is needed to produce that teeth. That's all that the machine will take, the precise quantity. So that could be one of the advantages that you can enjoy in the use of these manufacturing systems. So what are the clinical advantages of this? There is time saving. If you use the digital designs and the manufacturing system, what you would have achieved in 5 to 6 visits, you can achieve in 2 to 3 visits. Okay, there is reproducibility in the whatever you have manufactured or you have designed can be reproduced with great level of accuracy, and there is improved communication within the lab. Okay, so the dentist can communicate very efficiently with the technician, and the technicians can communicate with the dentist, or the technician communicating with technician. So there is intra-professional communication and interprofessional communication enhancement once you are using these digital systems. So some few limitations and challenges. We say that intraoral canals limit, there is problem with limited mobility and saliva management. There is high initial cost. There is material limitations, wear function, and resistance. Remember, we have expanded initially on the limitations and advantages in the other presentations. So please remember to visit them when you are trying to study about the limitations of these technologies. So that was the initial step. So the patient evaluation and data acquisition will be the first step. I don't know how much time we still have. I think we've run out of time. So what we are going to do is I'm going to introduce this aspect. We have just about 10 more slides with this. So what we are going to do is we will look at the stages. Okay, so the first stage is the patient evaluation and data acquisition, which you need the intraoral scanning systems, the impression scans, and the CBCT. The bite registration method and the facial scans for aesthetics are all involved in the first stage. In the second stage, you need the CAD designs. Okay, so you're talking about tooth arrangement with libraries, your visual trays, try-on options are there, and the aesthetic evaluations or the smile designing are there in the middle stage, which is the design stage. And also the third stage is the evaluations is the production stage, where you are printing the when you have printed the tri-indentures and final prosthesis will be milled and printed at this third stage, which is the manufacturing stage. Then the fourth stage will potentially be the delivery and the follow-up stage, when you verify the occlusion, the aesthetics, and the fitting. So you know you have done it with great level of precision. You just need to verify that it gives you the job, the work output that you expected. If there is any adjustment needed, you might want to do that. And then digital record storage. So this is the sequence of the workflow for a digital denture production. Okay, so you have the first stage. You need to know what technologies, what technical equipment you need for the first stage. The second stage, what technical equipment you need. So the first stage is the acquisition stage, where you are gathering the data collection stage. The second stage is the design stage. The third stage is the manufacturing stage, and the fourth stage is the delivery and follow-up stage. Okay, so let us be familiar with those. So there is a clinical case study. I'm not sure if this was the one that I did show you, but again, let me quickly confirm